So I reached out to Congressman Pocan's office yesterday and said, any preferences for walk-up music? And the response I got was, any Grateful Dead would work out just fine. And so, Congressman Pocan, Greg, I've created a monster part two. If you guys want to take the first 5 minutes and just do, Dead talk, I'm good with that, I guess.
That's what the people want to hear.
I'm with you. I still have a ticket stub for Jerry's last concert from Chicago. I was at, and I've kept the ticket stub. So.
Oh my God! Look at Greg's face. He is just—it's like he's in the presence of Grateful Dead royalty.
I love that so much. Well, enjoy it, sir. Enjoy it.
All right. Well, we have much to explore in future conversations. We'll get things going from Mark Pocan's work life by picking up where we left off in our last segment with Robert Craig from Citizen Action, and talking about healthcare reform and medical debt and trying to help households, avoid debt unnecessarily. It's one thing you can't control if you get sick or get in an accident or something, but you can control some of the decisions that you make when it comes to purchasing coverage. And Congressman, one of the things that Robert Craig mentioned that you've been working on are what's called Medicare Advantage plans, which theoretically are supposed to be improvements by harnessing the power of the private marketplace. It sure sounds to me like it can be a recipe for overspending. What's your impression of how Medicare Advantage is working, and what folks like you can do to watch out for the consumer dollar?
Yeah, so this is one we just want to caution people, because Medicare Advantage is a private insurance alternative to Medicare that is a case study on how lobbyists work in Washington. They crafted a bill that couldn't have been more profitable for private industry, for insurance companies, that's directly taking on one of the most popular services that we provide, Medicare, and threatening it. Just in overbilling alone from Medicare Advantage companies, it was $140 billion in the last time we kept track of that. That is enough to cover Medigap insurance for every single person on Medicare, or to extend dental, vision, and hearing to every single person on Medicare. And that's just where they're ripping us off, much less the prior authorizations they require. So if you have a medical issue and you're on Medicare, you go to the doctor and you get taken care of. You have that happen on Medicare Advantage, you have to get prior authorization, and they turn down millions a year. And here's the most damning statistic: 85% of those cases, when appealed, get overturned. You get the cut care, but delayed care is often death, bluntly, when you're that population. So, this is twice as profitable as normal health insurance. Companies are fighting hard to keep it the way it is. And fortunately, we have a group of members of Congress and some nonprofit groups on the outside. They're working together to try to protect Medicare, because only Medicare is Medicare, and also protect consumers from not getting the health care they need.
Between this issue and the one I mentioned in our last hour about Dick Eline's PAC having to change an ad about Medicare and Tammy Baldwin, I feel like there should be this new slogan: "Let Medicare be Medicare." Yeah. Don't misinterpret it. Don't try to gussy it up with things that are going to end up costing people more money. If you stick with its original intent, which is funny because we're talking about people who are normally big on original intent, you'd have a pretty damn good program going here.
Yeah, and if you really wanted to talk about Medicare, where we would improve it was we'd figure out a way to cover that Medigap, the donut hole that, again, the lobbyists, the industry created, or you'd figure out a way to add dental, vision, and hearing, because clearly that's healthcare. And that would make it better. And we could do all those things just with where we're getting ripped off on this experiment that has gone, pretty Frankenstein-esque. So, I just think what we're trying to do is make sure people are aware. The other thing, just to mention, Pat, is, they advertise, when you see all those commercials, that's Medicare Advantage. And they say, call and get information. No, you're getting a salesperson when you call those numbers. And they're trying to get more people, and they've got a majority of people in the country now on Medicare Advantage. But the calls I get into my office where people can't get care and have problems is when they go to Medicare Advantage all too often. And we just want to warn people, look, they have every right to go to a private insurance alternative, but they should know that there are a lot of consequences.
And it's been said before that, a really good first stopping place, maybe not everywhere, but in many, many, many places, would be your county office on aging.
Absolutely. Because again, one side is advertising Medicare Advantage. Medicare doesn't really advertise, right? So that's part of the situation. But getting that fair information. I've had nurses at town halls tell me like they didn't know because they're too big government, our government program, how to go. And as soon as they found out, they clearly understand medically, unless you're really young and healthy. The problem is Medicare Advantage gives you a free gym membership, or you'll get vision coverage or something that's a little extra. And people get enticed, especially if you're, first entering the Medicare age and you're healthy. It might seem like it's an advantage, but then years later, it's hard to get out of that and get back to Medicare. And then we get the complaints. So just really do research before you make that decision.
Let me go back a step for folks that might have missed it in the last hour, that this restoration pack, which is funded primarily by Richard Uline of the Uline packaging company, had to change an ad because it said that Tammy Baldwin had voted to cut, money from Medicare, when what it was because Medicare finally overcame 20 years of Republican opposition and is able to negotiate for cheaper prescription drug prices. You're talking about saving something like $160 billion over a 10-year period, saving money. And some Republican talking points go, oh, they're voting to cut $160 billion from Medicare. No. That's cost savings for the taxpayer. I can understand where some folks on the right might be confused by that, because they see if it's $160 billion not going into big pharma, there must be something lost here. No, it's actually a gain for the taxpayer.
Oh, Pat, it's so much worse. So there's a whole lobby core here also trying to stop us from doing what we did. And I don't think a single Republican has supported our efforts to negotiate for cheaper drug prices when we're getting ripped off as consumers. There's a story, if I can just share real quick. Katrina Shanklin was in town meeting with someone who is a lobbyist who used to actually work for a Wisconsin member. And I asked what she thought about, negotiating for drug prices. She's like, of course, it's great. It's wonderful. And the person said, oh, no, that's the wrong answer. The industry wants to continue ripping us off. It made me, more endeared to Katrina than ever for her reaction that, how could someone actually, say this? In fact, she even said, well, I won't go into the whole conversation. The bottom line is there is a whole industry here to make money and trying to stop this. So when Uline says this, it's just part of that effort to make it so that as consumers, we're the suckers again, and Big Pharma makes a lot of money.
Absolutely. Let's switch gears here and go over to the Farm Bill for a moment, which, of course, as we know, is more than 6 months late. Is due at least by this October. A lot of folks would like to get it done sooner, so it doesn't get caught up in partisan politics closer to Election Day. We've talked in the past about how House Republicans, or at least many of them, are supporting ideas for a farm bill that would lead to substantial cuts. What's new from Senator Tammy Baldwin's office yesterday is it sounds like Senate Democrats on the Agriculture Committee have now essentially worked up their wish list for the next farm bill, which I'm going to say, without looking at it point by point, I'm going to guess, Congressman, is radically different than your House Republican colleagues, which leads my question to you, which I admit is entirely speculative. But now that we know where Senate Dems are coming from and House Republicans are coming from, what's your feeling on whether Wisconsin farmers, consumers, producers are going to see some kind of a productive farm bill yet between now and Election Day?
Yeah, I mean, I'm worried because I just talked to a member of the Ag Committee over the weekend, and they told me unfortunately, it looks like the House is going to punt out a completely partisan bill, which is a shame because the Farm Bill, part of even how it's crafted is to make it go beyond partisanship. But hey, I'm in this session. I understand everything is going to be partisan from the House Republican majority. But in doing so, we have a deadline of September 30th of last year that we extended to the end of the year, that now we extended to this September 30th. And I'm worried that if you have two bills that are completely different, how does that get resolved? And it does affect people in Wisconsin. And don't forget two things. One, when the Republicans passed their original appropriations bill for ag, they cut spending 40% to the Department of Ag. So that shows where their real priorities are when it comes to agriculture. And two, if we don't get something done by the end of the year, we hit another, or actually by September 30th, it would be, because that's when we extended it. We go back to milk pricing law from the 40s, which greatly hurts Wisconsin's dairy farmers. So this isn't like just another thing to have, team red, team blue, like the House Republicans are trying to do. This is something that could have a severe impact in Wisconsin.
From the standpoint of land conservation and natural resources, there's a reason why programs exist where farmers would actually get paid not to farm certain lands. So that way they're not losing money by not farming it, but this is land that then can, be conserved, not developed. And yet, if I'm not mistaken, Congressman, that is one of the big targets of Republicans in the House, is to get rid of these conservation programs. And I do wonder what kind of an impact that could end up having for Wisconsin from both a farm family and an environmental standpoint.
Now, I don't believe they've put language to paper yet. So I don't want to speak for something that hasn't happened yet, but we know things that they've argued for before, and which would be a number of other things, including getting rid of the funding for the Dairy Innovation Fund that helps dairy farmers, right? It's money that I always found interesting, that when Wisconsin Republicans went to the rescue for the dairy farmer, they went to, not only did the Republicans cut the fund, the entire $25 million to help those dairy farmers, but when they had an amendment to restore it, Brian Stile and Derek Van Orden wanted to restore $10 million. They're 40% of the time there for Wisconsin's farmers. I want someone who's there 100%. In fact, I think we would ask for even more money than the $25 million for that fund. And, I think just you can get an idea of what's going to happen when we get to this. I mean, we've got to protect those farmers, especially those family farmers in Wisconsin. And when we finally see language, it's going to matter.
What I'm not hearing you say is that Wisconsin's one member of the House Agriculture Committee, Derek Van Orden, has been, like right there on the front lines, with you on behalf of Wisconsin farmers. I'm not sensing that from his office.
Well, he wants to be known as the Cheese King. So he definitely wants a title, but sometimes you got to do the work to get there. And he didn't on that Dairy Innovation Fund, right? That was a huge fail, only coming up with 40% of what they actually need, and didn't stand up to his caucus to do the right thing. So we'll see what happens as we get to the Farm Bill. Maybe he'll find a spine, but right now, I'm not seeing it.
All right, we've got just enough time. I know people think, oh, you're pushing it off. Yeah, I'm pushing it off. But let's go ahead and bring up the soap opera, Marjorie Taylor Greene, Speaker Mike Johnson, because the question's got to be asked this week. It sounds like the Congresswoman from Georgia is going to once again try to depose a speaker. What's going to happen this week, Mark? Anything?
So here's the problem. Marjorie Taylor Greene lives for TV cameras and attention. And she should really just go to her real calling, which is all-star wrestling, because that's what she really wants internally in her life. And unfortunately, the press corps in DC is like flies on poop. They just come to her when she does all this, and then she just kind of puts it off. I don't think the Republicans want to do this again. I was told by a Wisconsin Republican that this did so much damage to their caucus last year when they had these votes, that there's really no want to do this. So if this happens, I've said this is completely their problem. I will probably vote present if it comes up, because I'm not going to say that Marjorie Taylor Greene is in any way a serious legislator, because she's not. But I'm also not going to say we should defend the most homophobic and a whole lot of other things speaker that we've ever had in United States history. But this is all their internal problem. They created the rules that caused this. They have to live through it. Unfortunately, we all live through it also, but I'm not going to enable it.
No, and for folks that are saying, well, maybe Democratic leader Hakeem Jeffries, becomes a speaker at some point. Again, how much more soap opera can we handle? The Republicans are plenty busy right now to be worried about anything like that.
The way that happens, that Hakeem becomes speaker, is in November. We do this through the elections, and then we can actually have longevity in actual functionality again.
Stability, yes. All the good things that we should be expecting from the House of Representatives. Congressman Mark Pocan from the 2nd Congressional District. Always appreciate these monthly updates. Thank you very much. Take care. All right.
Thank you, Pat.